I will be assessing you from the top of your head to the bottom of your feet. Do you have any problems with me assessing you at this time?
No.
Uh, Before starting, do you have any pain anywhere on your body?
No.
On a pain scale of 0 to 10, do you have any pain?
0.
What's your age and your date of birth again?
I am 24, 11, 16, 1995.
Do you know what season we're in?
Spring?
Do you know what year it is?
2020.
Do you know who our president is?
Trump. Donald Trump.
Okay. The patient is alert and oriented times 4. I'm also going to be checking if there's any lines or tubes, no IVs or NG tubes anywhere. So my patient has no lines or tubes, and I've checked the room and the equipment is ready. Bed is raised to a working level. Lighting in the room is appropriate. I'm going to pull the current for privacy. I'm going to wash my hands, make sure I do hand hygiene, put on my gloves, and I'm going to ask the patient one more time for name and date of birth. What is your name and your date of birth?
Philani Cabignot, 11, 16, 1995.
I have confirmed that I have the right patient, and I'm going to check vital signs, temperature, heart rate, blood pressure, ask if they're having any pain. Are you having any pain?
No.
Patient is alert and oriented. And then I'm going to check head for bugs, masses or lumps or sores. Everything looks good. I'm going to whisper to the patient and ask them to repeat it back to me. I have nice hair.
I have nice hair. Nicer.
I'm going to check their eyes. Can you open your eyes? Can you close them for me? Sorry, I forgot to check behind the ear first. So I'm going to check behind the ears. And then I'm going to check the inside for any drainage or any redness. Everything looks good. All right, now I'm going to check the eyes. Can you open your eyes? Can you close them for me? And then I'm going to shine my light to check their pupils to see if their reflexes are right. And they both look good. They both constrict with light. The shape of the pupil is round on both sides. Her muscle movements, I'm going to check that right now. Can you follow my pen light with your eyes without moving your head?
Mm-hmm.
All right, everything looks good. I'm going to check nose for drainage.
There's a lot of drainage up there, doctor.
We'll get that checked for you later. And then I'm going to check for a deviated septum. If it's more than one side, then you're going to have difficulty breathing. Everything looks good. I'm going to check them out. Can you say ah for me?
Ah.
Check for bleeding gums or receding gums or any redness. Everything looks good. I'm going to look at the neck. I'm going to feel the neck for anything. Don't massage the carotid arteries. Ask patient to move their neck from left to right. Can you move left? Can you move it right? Can you lift your head off with a pillow? Do you have any pain?
No.
Going all the way down their arms?
No.
Starting from their shoulders? Can you pull back? Strength looks good. Can you push against my hands? Looks good. And then I'm going to do the heart assessment. So when listening 1, 2, and 4, I'm going to use the bell of the stethoscope. So I'm gonna listen to the apical pulse, and I'm gonna assess for a whole minute while the mitral actually. I'm going to use I'm going to listen to the mitral valve. Sorry, and I'm going to assess for a whole minute using the bell side of my stethoscope. Oh, I'm sorry. I'm going to use the diaphragm of my stethoscope. I am going to use my bell to listen to 1, 2, and 4. One is aortic, 2 is pulmonic, 3 is tricuspid, and 4 is tricuspid, and 5 is the mitral valve, which is at the 5th intercostal space at the mid clavicular line. Then I'm going to assess chest for breathing. I'm going to listen to lung sounds. Ask the patient to take a deep breath. Can you take a deep breath? Can you take a deep breath? Can you take a deep breath? One more time. Comparing each side of the lungs, and then can you sit up for me? I'm going to check the back of the lung sounds. Can you take a deep breath? Can you take a deep breath? One more time. Okay, last time. And I'm going to be listening for any wheezings or crackle sounds in the lungs. All right, you can lay down. And then I'm going to assess the abdomen. I'm going to look, listen, then feel. I'm going to look for masses or color of the skin. I'm going to listen to the right lower quadrant, up to the right upper quadrant, to the left upper quadrant, then to the left lower quadrant. Do you have any vomiting or issues going to the bathroom?
No.
When was your last bowel movement?
Yesterday or 2 days ago.
What was your bowel looking like? Was it consistent? What was the consistency? Was it soft? Was it hard?
Small, like it didn't want to come out.
Sounds like constipation. Did you have any pain or discomfort when you're urinating?
No.
Was there any blood in your urine?
No.
How about odor?
No.
When was the last time you ate? Did you have any problems while eating?
No problems while eating.
And the last time you ate?
I love eating. An hour ago.
An hour ago? Okay. Okay, and then I'm going to move down to the legs. Can they move appropriately? Feel for popliteal pulse behind the knee. I'm going to assess one at a time and then check the others. Then I'm going to assess the top of the feet. Everything looks good. And then You want to check the inside of the ankle bones. Make sure there's nothing wrong with them. Everything looks normal. No swelling, no inflammation. Color of legs. Then I would take off socks, assess the bottom of the feet, cap refill on bottom of the feet, push against the feet, make sure the cap refill looks the same, and it's coming back with a normal time, under 3 seconds. And then can you lay on your stomach for me? I'm going to check the backside of your body now. I'm going to look at the skin, no pressure ulcers, make sure everything's okay. I'm going to spread the buttocks, no redness, no discharge, no odor, no swelling. Everything looks all right. Nothing wrong, no swelling, no pressure ulcers. And then you can lay back on your back for me now. I'm going to move bed back into the lower position. Make sure patient has access to a call light. Here's your call light. Place bed rails back up, and then document and report any findings that was wrong with the patient.